Asian eyelid blepharoplasty post-op 7 days. I'm worried about the crease being too high and unnatural. The surgeon told me he placed the crease at 9 millimeters, took off 5 millimeters of skin, and left 15 millimeters of skin between the eyebrow and the crease. However, it seems that the crease is halfway between my eyebrow and eyelashes. Also, my eyelids are gauging inwards, and there is absolutely no drooping of the skin over the crease. I am worried about whether the crease is too high and whether there will be enough skin left to droop over the crease.
Thank you for your question. You've submitted some photos and you stated in your question that it is about 7 days after your eyelid surgery. You also gave more details about the 9 millimeter height and the amount of skin that was removed, as well as the amount of skin between the brow and the crease. So you have a lot of very good information that I'm glad that you were able to discuss with your surgeon. And of course, your concern is that the crease is too high and that there may not be enough skin to fold over. So let's now explore this a little bit. And first, let's start with just what your expectations were after your surgery. It is routine in my practice as a cosmetic oculofacial plastic surgeon for 20 years. I do a lot of Asian eyelid surgery. I've written about it, and I am certainly familiar with the different methods and techniques. But one of the things that I always discuss with my patients, and I think there's a good chance that probably your surgeon discussed with you, was that the initial swelling after Asian eyelid surgery typically makes the crease look very high. Now, there is, of course, variability. Some people swell more than others, but to understand that the space between the eyelid and the crease, called the pretarsal area, this area can swell tremendously. You see, the very nature of this type of surgery is there is a suturing, whether it's non-incisional or incisional, of the skin to the levator muscle, or the muscle that looks like the word elevator, but without the E, the levator muscle, the muscle that lifts the eyelid. What essentially it does, it almost acts like a tourniquet in a way to cause swelling to stay in a very limited space and expand. And when it expands, it makes the crease look high. So anticipate that after these 7 days have passed, every week that swelling will change, and that true eyelid surgery healing, even though you can have functional healing within a week and go back to work, is still 6 months to a year. And so understanding that, you'll appreciate that it takes a lot of time to really understand what your final result will be. Now, as far as predicting whether the skin will fold over, understanding that we don't have the benefit of your preoperative photo, and also understanding that if you made your decision based on finding a surgeon who has a lot of experience with Asian eyelid surgery, you can be confident that the doctor anticipated that in order to create a natural crease, that a certain amount of overlap to create the natural double fold would be necessary. There is an art to doing this. This art is also adjusted depending on a patient's skin type, the skin thickness, the age, the degree of fat volume. I mean, there are many factors that are taken into consideration, which certainly makes Asian eyelid surgery a challenge. So with that being understood, it is not likely you're going to get a prediction about the overlap until the swelling comes down. It seems intuitive that as the swelling goes down, the skin that would likely overlap will kind of sit in place and be more in the position. When we do our Asian eyelid surgery or surgeries like ptosis surgery, we will sometimes actually allow the patient to wake up a little bit so we can have them open their eyes so we can see how things look. But typically, by doing the measurements and planning ahead, we're able to consistently predict and get a nice result. So I advise that you continue communicating with your doctor, allow for the time to pass. You're not going to be able to do anything interventional anytime soon without disrupting the natural healing process. And of course, I think that the communication with your doctor will help you feel better about your anticipated recovery time. So I wish you the best of luck. I hope that was helpful, and thank you for your question.